In the United States, measles is becoming an important public health, like never before. And it is important to recognize and understand the origins of these problems and how can be can this problem affect the population of our country. At the same time, it is critical that we have updated information and scientific and accurate facts on the clinical presentations, risk factors, and countermeasures for this disease. And I have the pleasure to have two of the foremost experts in clinical infectious diseases with us today to discuss this topic. So, welcome to Editors in Conversations. The objective of this podcast is to define measles as an important public health threat, explain the origin of this epidemic, and present accurate information on countermeasures and strategies to tackle this outbreak. This episode is brought to you by the American Society for Microbiology and our journal Antimicrobial Agents and Chemotherapy, which is published by ASM. The journal is available at asm.org/AAC. I'm your host, Cesar Arias. I am the editor-in-chief of AAC, and you publish in journals of the American Society of Microbiology, and you are a member, you can get up to 50% discount in fees for publications. As usual, please check out the other episodes of our podcast. Most importantly, the latest episode of our journals with phenomenal papers on mechanisms of resistance, pharmacology, antimicrobial agents, epidemiology, and clinical therapeutics, among others. We have specific sessions about challenging clinical cases, antimicrobial resistance, and a very recent section on the microbial stewardship that we enjoyed. Joining to discuss this topic, I'm really pleased to introduce Dr. Hana Sahly, who is professor at the Kyle and Josephine Morrow Chair at the Department of Medicine, Molecular Biology, and Microbiology in the Vaccine and Treatment Evaluation Unit at Baylor College of Medicine here in Houston, Texas. She's actually across the street, so I'm very fortunate to have her around. And Dr. Natasha Halasa, who is the Craig Weaver Professor of Pediatrics at the Vanderbilt Institute for Infection, Immunology, and Inflammation at Vanderbilt University in Nashville, Tennessee. Welcome to the show. How are you doing, guys?
Hi, Cesar. We're okay.
Right. So we are okay, just surviving in this incredible, difficult situation that we're dealing now. And I think for me, it's very important to use these channels to provide people who are many listeners with the accurate information. And you've been working on this. You understand the topic very well. So, Dr. Sahly, what is measles and how is it transmitted? Let's start from the basics.
Measles is a respiratory disease. It's caused by the measles virus. It is transmitted amongst humans by droplets and airborne mostly, but inanimate objects can also transmit the disease to a lesser degree. It is mostly an upper respiratory disease with the main classic complaints being coryza, cough, and conjunctivitis, red eyes, runny nose, and coughing. The disease is contagious, the most contagious disease we know, and it is mostly contagious 4 days before the rash begins, and 4 days after the rash begins. Once the disease incubates and causes the symptoms, it is most of the time it does result in a recovery. However, there are important complications, and they're not rare. It's important to note that 1 in 20 individuals who come down with measles will have pneumonia, viral pneumonitis. 1 in 1,000 will have encephalitis, leaving them with disabilities. And 1 in 10,000 will have the fatal complication of sclerosing panencephalitis, SSPE. So, and given that once it hits a community, especially with low vaccine coverage, while these complications may appear rare, when you multiply it by a large number of individuals coming down with measles, it becomes an important public health threat.
Yeah. So, I mean, you've heard about measles, of course. I probably had measles when I was a child, and I grew up in Colombia. Um, but there are vaccines. You know, the United States was in a very good position. So, Dr. Halasa, why are we talking about measles in 2025, the 25th century?
As you said, at least in the United States in the year 2000, there were no endemic cases of measles that were circulating in the United States. Unfortunately, over time, vaccine coverage has gone down. So if you maintain in the population a vaccine coverage of 95% or above, that will provide enough protection that individuals in a community should not have an outbreak of measles. Unfortunately, during the COVID pandemic, coverage used to be over 95% and now has decreased to 92 to 93%, which then allows individuals who have been unvaccinated, traveled to foreign countries that had measles that circulate, they get measles and then they come back to the United States, and then they have been causing outbreaks to individuals that have not been old enough to have their vaccines yet, so those under a year of age, or individuals that have not been vaccinated for different reasons, or individuals that have been vaccinated but have a very weakened immune system and therefore put them at risk for measles.
So you mentioned something really interesting, which is even a small changes in the population vaccination can lead to important number of cases. Can you elaborate a little bit on that concept?
Yeah, so herd immunity and having enough protection within a community. So the magic number has been reported at 95%. So if 95% of the population has immunity to measles, then it's less likely to result in an outbreak. And so when it starts to fall below 95%, in which we're at 92 to 93% currently of individuals that are vaccinated, it then allows for individuals to become infected and then therefore cause outbreaks, which we are seeing, unfortunately, which in your state of Texas as the one where it started and had the majority of cases.
Yeah. So Hana, tell us about the numbers. I mean, how bad is it right now?
Yeah, it is. It's relatively bad. As of today, in 2025, there are 1,227 confirmed measles cases in all over the United States. They are spread into from 23 different outbreaks, with the largest outbreak being the one that started in Western Texas, in Gaines County, and spilled over to neighboring areas, mostly New Mexico. That particular outbreak alone accounts for 750 cases of the total, and that's just the Texas ones, not the spillovers. The outbreak is not without risks. So far, 17% of the individuals were sick enough to be hospitalized. And we do have 3 confirmed deaths so far. And judging by what we know about mortality of measles, which is on average 1 in 1,000, but there's even variability in that number, but on average 1 in 1,000, that tells us that the outbreak is underreported as well. So the number should be closer to 3,000 cases nationwide with 3 confirmed deaths.
And just as a pediatrician, I just want to say that it's unacceptable for even 1 death for a vaccine preventable disease. Like, we have a vaccine that is effective at preventing deaths. And so each one of those cases are incredibly sad because these are vaccine preventable deaths. And I just really, really want to harp on that. So
very important point. And when was the last time?
No, I just want to echo Natasha's point, which is one of the most important interventions that the vaccine programs have launched in the last 25 years is expanding measles vaccines in poorer areas of the world. And that alone accounts for most of the averted mortality in children. We are talking millions of lives saved. And so it is preventable. Definitely the death and the complications are preventable.
Yeah, and it is hard to think about when was the last time that we had a death for measles in the United States. When you look back, it's very difficult to find very recently. So this is something that we knew already, that we knew how to deal with, and we somehow decided that it was not worth it, that it's okay when people die. And that's very, very difficult to accept for all of us who are dealing with patients. So, Dr. Halassa, why don't we talk about the kids? Because there is this idea there that, well, this is nature we need to interact with the microbes. And so what happens with kids that get measles?
So exactly what Dr. Hana talked about earlier is kids commonly will present sometimes just first with fever, and then some respiratory symptoms of cough, runny nose, and red eyes. And then within a couple days, we'll have a rash that starts from the head and spread all the way down through their body. Sometimes they'll actually have white spots called complex spots that can present even before the rash appears, for people to think about it. So as stated earlier, vast majority will do well, but commonly they'll have an ear infection, so otitis media, complications of diarrhea that puts them at risk for dehydration, 1 in 20 having pneumonia, and also being at risk for being hospitalized. And so all of these things, these complications, where you can't predict who are the individuals that get it. Most likely it's going to be in the kids that are younger than 5 that are going to have these complications, but you can't predict that. And so also those that have vitamin deficiency can have increased risk of severe illness. And so, as we said, we have a vaccine that prevents them from having severe illness.
And it is clear that, can produce really debilitating sequelae in those kids, particularly when there is effect of the system, the central nervous system and the brain with this inflammation. So the majority of adults, Hana, in this country are vaccinated. But when you have a virus like this and some of these vaccination protection wanes with time for many reasons, old age. So adults also can get measles. So what happens with adults when get measles and how bad could it get?
There are certain determinants of the host that are important to consider. So a vaccinated person will get a much milder disease. An immune-compromised person will have a much more severe disease. The clinical manifestations otherwise resemble those of children with red eyes, cough, and runny nose, and in a few progressing to pneumonitis and encephalitis. However, there are data that indicate that children under 5 or adults seem to be at higher risk of those complications. So similar presentation, but probably more risk for complications.
And in particularly the lung involvement pneumonitis and particularly encephalitis are very daunting in patients who have immunocompromised conditions. Can we talk a little bit about those, Hana, and expand a little bit, particularly since we now have people walking around because of the advances that we have in transplant, cancer, some of these rheumatological diseases that are severely immunocompromised. And these people do a normal life. They travel, they take a plane, they congregate, they go to stadiums, they go to barbecues, etc. So how bad could it get in an immunocompromised patient?
They have a higher risk of those fatal complications we just discussed. And actually, one complication that seems to be even more peculiar to immunocompromised is the inclusion body encephalitis, which is a rapidly progressive encephalitis. So they are at higher risk of catching those complications and ending up in the hospital or dying compared to an average person. Keep in mind that depending on when they became immune compromised, is it before, were they born with immune deficiency, or did they get their vaccines and then were immunocompromising them with prednisone and biologics? They may not have been even eligible for the vaccines, right? And that is another reason why we need to maintain a high level of immunity in the community to halt, to halt the spread of the virus at more interfaces in the community. These individuals, many cannot get the vaccine if there was an outbreak, right? Like for biologics, you need to wait 4 half-lives or 5 half-lives for it's safe to vaccinate them. For transplant, on chemo, etc., they may not even be eligible. So these individuals, even if they wanted to, they can't get the vaccines, and they make a large and enlarging segment of the population. And that's yet another reason from a public health standpoint to maintain high rates of vaccination.
Excellent points. So, Dr. Halasa, people will say, well, what's the treatment for measles? Do we have anything to treat measles?
So right now, there's no treatment for measles. As I said earlier, people that have low vitamin A or have vitamin A deficiency are increased risk for severe illness. So we administer vitamin A with those that have an active measles case, especially those that get hospitalized. There is a antiviral that's out there called ribavirin. However, that in the laboratory has some activity, but that is not something that we give individuals with measles. So really, it's supportive care. If they need oxygen, we give them oxygen. If they have pneumonia, if they're dehydrated, we give them IV fluids. So right now, there is not a treatment for measles. But as I said, I'm going to keep harping on, we have a prevention that's very effective and very safe, that does not cause encephalitis, that has very, very rare side effects compared to the natural disease, and that we can prevent this illness through measles vaccination. And we need to, as Dr. Hana said, we need to protect those that are vulnerable, who can't get the vaccine. Either they're too young, they're less than a year of age, or they're immune compromised.
So thank you for clarifying that. So, and I think it's important to emphasize that apart from those risk factors, it is really very difficult to predict who is going to get complications.
Absolutely.
So you can't really assume that you are going to just develop natural immunity and then you're going to be fine, because you don't know how maybe there is a molecular defect in your genes that you have never been aware that will put you at higher risk and we don't know about. So prevention is the key here, okay?
And it's highly contagious. It's super contagious. We think like flu might be contagious, SARS-CoV. Measles is the most highly contagious respiratory virus that's out there. So that's something that's really important to know, that you've seen anywhere from 1 in 9 to 1 in 18, depending on what statistics people are talking about. So it's highly contagious.
Okay, so that brings us for the next question for Hana is, this is unavoidable now, okay? So we have these cases, we're gonna have to deal with this. How do we prevent a spread of this virus and a disaster of public health?
This is very important. There are some reassuring signs that maybe we're getting into a plateau into the current outbreak, and maybe we're getting to the end of it. But it does highlight the importance of maintaining high levels of vaccinations. So the counties where the coverage has come down below 95% have to revisit their vaccination policy and intervene. proactively, because this is not going anywhere. The other thing to keep in mind is that between COVID and between the recent cuts into the WHO and the expanded program on immunization, etc., these are the programs that were reaching a lot of underserved areas in the world to vaccinate against measles. These are now having a lot of cuts to their funding, which means more measles outside of the US, which means more measles inside the US. So if we are to protect the community and to protect especially the vulnerable children, the immune compromised, etc., and to protect ourselves, not just the vulnerable amongst us, it behooves the public health authorities at the local levels to design campaigns to reach as much as feasible to bring that number above 95%. Should we get in an outbreak situation right now, probably individuals who would need an additional dose, who are, for example, now not otherwise eligible. Like if I'm a healthcare worker and I have documentation of immunity, I'm fine. But if there's an outbreak and people start pouring into the hospital, we're going to have to vaccinate all the healthcare workers. We're going to have to, it has so many implications down the line if we don't act now in the counties with low vaccine coverage.
And I think it's also important to note that it's not foreigners that are coming into the US that are spreading it. It's individuals that are Americans going to foreign countries, contracting measles, and then bringing it back to the US and causing outbreaks. So I think that's something that's really important. And then why it's important to have less exemptions for individuals to not give measles vaccine to their children.
And Americans love to travel, in the summer.
We love to travel.
So, okay, let's talk about the vaccine, Natasha. I mean, you are a pediatrician. You deal with parents. So there is a lot of misinformation out there, right? What are the facts of this vaccine? So let's put it clear, transparent, so everyone knows exactly what to expect.
Yeah, so the measles vaccine is recommended to start at 12 months to 15 months to get your first dose, and then 4 to 6 to get your second dose. And so 93% of individuals get one dose of vaccine are going to develop immunity to measles. To get to 97%, that is why we recommend a second vaccine. To those that didn't take to the first one, will take to the second. So that's when you get the vaccine. And the reason we don't give it under a year of age is because the interference of maternal antibodies and the immature immune system. So it's a combination of both. If someone is going to go abroad and it's an infant, they can actually get the vaccine anywhere from 6 months to a year of age. They will just need to get 2 doses again when they return and after a year of age. If we're in the midst of an outbreak, you can actually get the measles vaccines twice, but it has to be at least a month apart. So that's when you get it. It's incredibly safe. It's incredibly safe. There are some side effects, just like all. You do not get natural measles from getting the vaccine. However, some people can get fever. Some people can get rare but low platelets after it. And even some people can develop a rash. So these are some side effects. There has not been reported cases of encephalitis from the vaccine. But as Dr. Hana talked about earlier, there is encephalitis getting natural disease. And it's more likely in kids that get measles under 2 years of age.
So I think this is very important to emphasize the safety of this approach and the results that had been produced for many years on our population, which is preventing cases from this. So this is very clear. So Hana, you mentioned before about these vulnerable populations and the inability to get vaccine because they're live vaccines, and the immune system will not deal with that, and that will definitely increase the risk. What other measures do we have to do in these patients? Like, is there like immunoglobulins? Is there anything that we can do for these patients?
One thing to keep that is important: vaccinate everyone in the household. If they can't get the vaccine, everyone else around them who can get the vaccine should be vaccinated. Should they be? There are certain immune compromised individuals who can get it. For example, if someone has HIV and their CD4 count is maintained above 200 and they are on medications, they can get the vaccine. But others, it's risky. In others, it's risky. So there are immunoglobulins that can be given in the event of an exposure. So, and keep in mind, if we are in an outbreak, reaching everyone who needs it and having the supplies and the infrastructure that is already, not optimal for healthcare, that's going to be a challenge. So I go back to Natasha's point and your point: prevention of outbreaks is key.
Okay. So just to conclude, so I'm going to ask you guys to see your crystal balls in front of you and then predict what's going to happen. I mean, we are dealing with many challenges at the moment. And so let's start with Natasha. What is your outlook for the future with these preventable diseases in general, not only measles?
So I think it's really important as pediatrician, healthcare workers, providers, those that are in the trenches, educating many individuals. Because even myself, I started residency in the late 90s. It was only, in my entire career, I've only seen one measles in the US, and that's because it was an unvaccinated individual that went to Vietnam, ended up getting measles, and came back to the US. Thankfully, it did not cause an outbreak because at that time, vaccination rates of measles were above 95%. So it did not cause an outbreak. So I think it's important, one, to educate residents, medical students, those that have not seen the disease, of what natural disease does and why it's so dangerous. And then educating parents and caregivers of the natural disease versus the vaccine. And I think being advocates for truth and being advocates for facts, and really doing what we're doing now, podcasts where we're bringing it to the forefront and explaining why we vaccinate, what natural disease is, why it can be devastating, and how we all have confidence in this vaccine that has been given to millions and millions and millions and millions and millions and millions of individuals, and have saved millions and millions and millions and millions and millions of lives and deaths. That this is what we can do. So
Yeah.
Thank you for having us here to have this discussion. I think that's one of the things that's really important. We take for granted that vaccines are so effective that people forget about the natural disease. And so we just have to remind people why we are here where we are today.
Until we have this exactly in front of our noses. Hana, your predictions.
My crystal ball. My crystal ball is I'm gonna do a short term, long term. In the short term, I see a dark cloud hovering in terms of vaccine dissemination and acceptance, whether by choice in the United States or by necessity in the countries that are either undergoing conflicts and war, or that are now being deprived because certain organizations lost funding. So it's inevitable that we're going to see surges of cases. However, in the long term, history is dialectical, and when the pendulum swings in one direction, people are going to go to the book. It's like, what did they do to prevent measles in the past? How did the WHO prevent so many millions of deaths and distribute billions of doses, and everybody was fine? They're going to find those data that are in plain sight, and they're going to follow sort of common sense again, once we pay a bit of a price for it. I just cannot see how we're not going to pay a bit of a price for what's going on here and outside. So these are our predictions.
Okay, so things are going to get worse before they're going to get better, but hopefully they will. No, I think you are absolutely right. Things are going to get worse before they get better, but we should focus on the better part. And I think and try to do the best we can during the worst part, which is the short term, as you mentioned. Well, it's been a wonderful conversation. Thank you very much for taking the time and giving such a clear and wonderful messages. This is Cesar Arias, Editor-in-Chief of AAC, signing off.
Thank you, Natasha. And
Thank you. This is wonderful.